For breast cancer, there's some other things that could precipitate or cause breast cancer, or at least contribute to perhaps the development of breast cancer. We know that hormonal therapy, as some women are placed on, we worry about that being a causative or a triggering agent for breast cancer. I mentioned the genetic, that's a small percentage of patients we see. Dietary considerations, we worry about that also. But those are the more common things that we perhaps see that may be related to breast cancer. As far as lung cancer, still the primary thing that we see as a causative agent for lung cancer is smoking. There's no question about that. So that prevention for lung cancer is still smoking cessation for most of the patients. Colorectal, again, cancer. There are some cancers that are colorectal in origin or GI in origin that can be genetically related. But we question about dietary type predisposition that way also, that trying to limit dietary fat intake and that sort of thing may be part of the causative agent for colorectal cancer. But we still don't have a good answer in most types of malignancies what the triggering agent is. We clearly see cancers as patients get older. I would like the patients to remember me, I think, by knowing that as close as humanly possible, I gave them 100% of my efforts, and again, got to know them as people and individuals as well as patients, and again, help their families through trying times. I think that would be what I would most want as a physician. Also, I can't ever imagine retiring either, so that's a whole interesting question in and of itself. But I know there'll come a time that I'll probably need to do that, but that's a very difficult thing for me to even conceive of right now. The difficulty a lot of times with the diagnosis of cancer is that we tend to find the patients a lot of times after the cancer has already spread from its original source. So the more we can screen patients to find things earlier, the better, and all the community events that encourage patients to do that it's an extremely important part of our cancer program. And again, the hospital has sponsored a number of programs as far as community events and screenings and that sort of thing that have promoted that. And again, that's a real plus for the hospital and attempting to keep the community as healthy as possible.